Well, measles may seem like just a rash, but it can also be a killer. One patient in 500 dies from the disease, with one case confirmed and possibly new cases showing up in Ann Arbor. Doctors are becoming concerned that more and more parents are choosing not to immunize their kids. At 4 months, little Kylie has already had some of her childhood immunizations.
Considering she was 4 months early, that she was going to need them.
But the fear of side effects, including possibly autism, is keeping some parents from getting immunizations for their children, especially MMR, which stands for measles, mumps, and rubella.
They hear lots of things in the newspaper, on television, or from their friends and family, and they worry that giving their kids the shots may in fact cause problems.
Dr. Marcus DeGraw of the St. John Health System says parents might feel differently if they spent more time in his office.
We don't see polio anymore, in part because of the immunizations. We don't see bad diseases in our communities from these infections simply because most of those kids are in the hospital. Pediatricians and physicians who work at the hospital see it every day.
If a parent insists, he'll space shots further apart or substitute one for another. If they're still concerned, he tells them.
The immunizations I'm going to recommend for your kids and that we're going to talk about, I'm giving to my own children. I have 2 daughters, and they're going to get the exact same shots I'm going to recommend for your children. And if I felt there was a shred of evidence that made any sense linking bad outcomes to shots, I would think twice about giving it to my kids, and I don't.
Dr. DeGraw recommends that parents look for information from sources they trust. You may want to begin with your own pediatrician. And he suggests you look at the National Institutes of Health website. We've put a link to it on our website at WXYZ.com.